Burns here, and there's a link in there where you can sign up for OMED, pre-register, and spend that $10.
Yeah, I would encourage everyone to participate in OMED if you can. They usually have it as a face-to-face meeting, and we'll go there and be there, but they have lots of speakers from different places talking about the whole process of getting into medical school and what it's like to be at medical school and what the interviews are like and all that kind of stuff you need to know for applying to medical school. This year they got a speaker talking about the impact of the COVID-19 pandemic on your applications to medical school and how that's going to affect all of you, so I think that's all important to know. They also have in the afternoon, and the time's listed on there for what time each of these events happen, but they have kind of a fair, a time when they have the admissions officers from all the different medical schools from across the entire state who will be there, who can talk to you and answer questions and tell you things about, their particular medical school. So it's a great opportunity. So I think everyone should take advantage of being able to participate in OMED, and it's online this year, so you don't have to go anywhere. You can just do it from home and just log in from your computer. But do make sure you go and register, because there is a limit. They're only taking 500 students from across the state, and when that's full, they're not letting anyone else in. So make sure you register and get your place reserved.
Yes. Okay, so we are also a little bit limited in what the pre-med club can do this semester, but there are some things that we're going to continue doing. We're going to have Zoom calls for doctors, and we're going to try to get a medical student or a medical school admissions officer to come in, at least virtually, and talk to you about medical school that they work or are enrolled at, and what things are like during COVID and what things are like outside of COVID. All of that is going to be done. We're trying to get a doctor right now who is a infectious disease specialist down in Florida, right?
Yes.
Yeah.
He's going to do the 16th. He's already agreed.
Yeah, our very next meeting, we're going to have him on the call.
Dr. Cody Horn, he was a former student here at Shawnee State, so he went to school here. He went to medical school at OU and did his medical school there. He did residency down in Florida, and he's an infectious disease specialist down there. He's been there through the pandemic as well. So I think it'll be real interesting to hear from him about the whole specialty of infectious disease, but also what's been going on with regard to the pandemic for infectious disease specialists right there, in the hospital with patients. But he'll be here, not physically, but he'll be here via Zoom, for our next meeting on October 16th. So you will be able to come here and, watch him on the screen and do that. But you'll also be able to, and we'll send emails out with all the links, to just log into the Zoom meeting from anywhere on your computer and participate in the meeting and be able to see his presentation and ask him questions and stuff from wherever you might be. So you don't necessarily have to be here. But Dr. Cody Horn is going to be in our October 16th meeting to talk with us. So.
Yes, we typically will talk mainly on how our doctors, our students, and how Dr. Burns can guide us into getting into medical school. Typically, without COVID, we would take trips to things like OMED. We went to Cleveland last year. That was very fun. And we also went to Athens to check out OUHCOM, the DO school for Ohio University. It was very good. Sometimes we get doctors, other times medical school students or officers. Sometimes we get military recruiters that come in for whatever the military can offer us. Aside from that, we will host parties with the other science clubs, being Tri Beta and Chem Club. Tri Beta is a research club for biology mainly, and Chem Club is it's essentially an ACS branch that can help you with preparing for the ACS finals that they always offer. And one last thing, we have shirts. Now, a lot of people signed up for shirts last year, but we weren't able to get it because of the COVID and the COVID start. But we have the shirts. It is a navy blue t-shirt. It comes in soft for $14 or just a normal cotton for $10. It's got a stethoscope on the front with a badge that says Pre-Med Club, and it has the snakes with wings and the staff on the back. Very nice design, and I'll leave that up here for anyone who's interested. But for now, we have Dr. Burns with our first lecture.
Okay, so yeah, do come up and sign the Pre-Med Club t-shirt, thing whenever you want to, that's fine. But today I'm going to talk a bit about just, getting into medical school, things you should do as a pre-med student to make sure you're prepared for medical school. And so, first thing you're going to be thinking about if you're thinking about medical school is, of course, academics. We recommend that if you are planning to go into medical school or any of the other health professions, whether it's dental school or chiropractic or veterinary medicine or physician's assistant or whatever it might be, we recommend that your major be the biology major on the biomedical sciences track. And the reason we're recommending that is because the biomedical sciences track already includes all the prerequisites you need to get into these professional schools. That way, just by finishing that degree, you've already got what you need to get in. You don't have to worry about, did I take the right courses to get in? If you want to go to pharmacy school, we do recommend that you major in chemistry. And there is a pre-pharmacy track on the chemistry degree that you will want to major in. You should certainly talk frequently with your advisor to make sure you're on track with getting your program done. And very important will be to maintain a good GPA. Medical schools and all of these other professional schools, they are very competitive. If you don't have a high GPA, it's going to be hard to get in. So you want to do well in all your classes, and you want to make sure that you start that way from the beginning. Don't do poorly in your classes for a couple of years and try to make up for it when you're a junior or senior, because it's very hard to move your GPA once you've taken a lot of hours. So start from the beginning, study a lot, do well in your classes, and maintain a high GPA. As you get to some of your upper level courses, you'll notice on the biomedical track we have a lot of upper level microbiology and anatomy courses. Take as many of those as you can, because they're all focused on medicine. They're going to be talking about things which are important to you and will help you when you get to medical school. These are things like the cadaver anatomy course, which is going to be very useful to you when you get to medical school. The other thing everyone gets concerned about with being a pre-med is that you're going to have to take the MCAT. If you're going to some other kind of professional school, dental school, optometry school, whatever it might be, they all have some kind of admissions test that you have to take. So you're going to be taking some kinds of admissions tests, whether it's the MCAT or one of those other tests. So you should start studying for these tests as early as you can. Take advantage of any opportunities you have for practice exams or for review sessions or anything you can do to help with studying of these. But also think about if you want to take some kind of MCAT prep course or admissions test prep course for whatever test it is that you happen to be doing. They have these available. They're done by Kaplan and by Princeton Review. There's lots of them out there. They are expensive, so they can cost a lot to take one of these review courses, but often it can be very helpful in helping you get ready to take these exams, and you might be able to do better. The least expensive ones are completely online, but the online one, the issue is you have to be dedicated enough to go online and spend the time studying and learn it. For a lot of people, if they're scheduled to go to a course, they're more likely to go and spend the time and show up and do it than if it's just online when they can go on whenever they want. So certainly think about what's best for you. But think about doing some kind of a prep course. It could help you with your admissions exam. Whether it's the MCAT or some other admissions exam, you should take it in the spring of your junior year. I mean, a lot of people around here will wait till spring semester is over because we get out like very beginning of May. They'll spend that month of May doing their final study to get ready for the exam, and then take it early in June or at the very end of May, and that will be a good time to take your exam. Don't wait until, August of your senior year to take your MCAT. You're going to be too late with all your applications. It needs to be done at the very end of your junior year so that you can get your scores back and get your applications in time. If you don't do well on your admissions test the first time, plan to take it over. You can take it over and improve your score. There are several resources we have that could certainly help you with getting ready for your admissions exams. In the student lounge up on the 3rd floor, there are a lot of exam prep books. We have some for the MCAT, we have some for the GRE, we have some for the DAT, for dental students. There's a lot of these up there. I know the lounge is closed right now because of the COVID pandemic, but if you need some of these prep books out of the lounge, come talk to me or one of the other faculty and we can get them for you. But you can take these books and use them for free, and they can help you with studying without necessarily having to buy something yourself. AAMC, the company that runs the MCAT, they also have a lot of resources on their website about how to study for the MCAT. Some of these are even free resources, like they're going to have, starting in October, a free full-length practice exam that you can get to there on the AAMC website. They also have a lot of practice exams that you can buy, so you can have others you can get besides the one free one that they give you. And starting in October, they're going to have a whole section where it's going to have practice exams and study guides and tips and videos dedicating to the CARS portion of the MCAT. CARS is essentially it's an analytical reasoning section. It's about the same thing as what they used to call the verbal section. And it's one of the parts of the MCAT that our students here tend to have the most trouble with. But that resource will be up there on the AAMC website where you can get information to help you study for that. There's lots of other resources that you can get in terms of helping to study. You can buy review books and study books from Kaplan or Princeton Review or Exam Crackers or any of these other places and study through those books. You can take the prep courses that we talked about. Khan Academy also has an entire MCAT section where they'll go through and help you study for the MCAT. So there's lots of places you can look at, and you should take advantage of any of those you can so that you'll know what's going on with the MCAT, and you want to be prepared for this test. The MCAT itself has 4 sections. Biological and biochemical foundations of living system, essentially the biology section. It does include organic chemistry in the biology section, so certainly make sure you know organic chemistry. Chemical and physical foundations of biological systems, so this will include general chemistry, physics. Biochem will also be included either in the chemical section or the biology section. Critical analysis and reasoning skills, that's that CARS section that I already mentioned. It is one of the hardest sections for most of our students here. And then there's the section on psychology and sociology. So make sure before you take the MCAT that you have taken a psychology course or a sociology course, and I would recommend doing both. Even though you only need one for the GEP, take both psychology and sociology because they're both on the MCAT. Make sure you've taken chemistry, organic chemistry, physics, and biochemistry before you take the MCAT because all of those are going to be on there. And so you need to be well prepared when you take it. Each section's worth 132 points, so the maximum will be 528 points. If you score a 500 on the MCAT, you're about at the 50th percentile, which means you did better than about half the other people who took the exam. That would be really the minimum to think that you're going to have a good shot of getting into a medical school. Below 500, it's very unlikely you're not going to get in. It's going to be very hard to get in if you're below a 500. At 500, you have a good chance of getting into a medical school, particularly a DO school and osteopathic medical schools such as OU. If you want to get into one of the MD schools, one of the allopathic schools, you want around a 510. They're wanting a much higher score than the DO schools to get into those MD schools. So certainly you want to do well on the MCAT. So start studying early and spend a lot of time studying before you take it. Don't take the exam until you feel like you're ready, because you want to do well on this. And if you take it more than once, the schools will see your scores from every time you take it. They're not just going to see the best one. They will know how many times you took it and how you did each time. Any questions about admissions testing? Other things you should be doing. Shadowing. You will have to write about your shadowing experiences on your application. You'll have to list what you've done and talk about them. You need to start shadowing as soon as you can. Starting your first year of college, start shadowing now. Whatever level you're at, you should be doing shadowing. Shadowing basically means you're going to a doctor and you're watching them. You're seeing what they do. The medical schools and all of these other professional schools, if it's dental or chiropractic or whatever it might be, they all want to know that you spent time learning what the people in these professions do. You should be shadowing doctors or chiropractors or veterinarians or dentists or optometrists or whichever profession you're interested in. You should go shadow these people. Finding a shadowing experience, talk to a local doctor who you know. Talk to doctors in your hometown where you can go shadow when you're home in the summer or over Christmas break. Talk to doctors who used to be Shawnee State students. They're all very happy to have people come and shadow. And of course, contact the area hospitals so that they can help you arrange shadowing experiences. At SOMC, you want to talk to Jill Martin. She's in their volunteer office, and she will help you get shadowing experiences arranged. At King's Daughters, call volunteer services and talk to them about arranging shadowing experiences. We do have a lot of doctors in the area who are former Shawnee State students. They're all right here nearby, and they're happy to have people shadow. And so you can talk with any of them about arranging shadowing experiences. I know right now with this COVID-19 pandemic, a lot of doctors and hospitals are either not taking or taking much fewer students for shadowing than they did in the past. But over time, those restrictions will loosen up and you will be able to get in for shadowing again. So you should definitely be trying to get this arranged for when you can do it, because it does have to go on your application. They want to see that you're excited about medicine, that you want to be doing this, that you spend your time going out and shadowing these doctors, because that's what you really want to do. That's what you want to spend time doing. And people always ask about, how many hours of shadowing do I need? As many as you can possibly get. The schools aren't going to tell you need 50 hours of shadowing. It's not a requirement you have to meet. It's that I'm so excited about it, I'm going to do it every chance I have. And that's what they want to see. Seeing that you went and shadowed for a couple of hours the summer before you mailed in your application, that doesn't mean anything. That's meaning I did it because you told me to. That doesn't tell them you're really excited and want to be there in a doctor's office doing medicine. So they want to see this continuous shadowing experience throughout your time in college. That's where you want to be. That's what you want to be doing. So arrange shadowing experiences. Any questions about anything? Another thing you might want to consider is research. Okay, you can do research as a junior or senior. Think about what area you're interested in doing research in, and then talk to a faculty member who works in that area. So if you're interested in particular in microbiology, you might come see me. If you're interested in animal biology, you might see Dr. Sarah Minter. If you're interested in biochemical chemistry, you might talk to Dr. Napper. You know, whatever you're interested in, go see a faculty member who does things in that area, because we all have research programs going on involving students. And you do get credit for course biology $44.95 for doing research. It's repeatable. You can do research every semester, and you do get credit every semester for doing research. And it looks good on your applications when you're applying to your medical or professional schools. Any questions so far? If you want to go on a mission trip, you certainly can. These are not required by any of the medical or professional schools, and they're not even expected. But some students do them, so certainly if you want to do them, be aware of that, and you can do those if you want to. There are a lot of them available out there. Some of them are even sponsored by medical schools, but the thing you need to watch out for is that most of them are very expensive. You know, for most of these, you have to pay your own travel, you have to pay your own accommodations when you're there. They can be very expensive to do, so this may not be something a lot of people will participate in. Another thing is the medical and professional schools, particularly the dental schools, have been complaining about people going on these mission trips and then doing things they probably shouldn't do because they're over there. You know, you go to some third world country on a dental mission trip, and the person you're there with says, okay, go pull this guy's tooth, and you go do it. The dental schools are going to say, we don't want you, we're not going to let you in. You've done something you're not licensed to do, something you should not be doing. They're not going to let you in. It's the same thing with medicine. When you're in a foreign country on these mission trips, even if it's legal there for you to do it, you should not do anything on that trip that you would not be able to do while you were here. Basically, the only thing you can do on these mission trips is essentially shadowing. You're watching other doctors do stuff. If they have you do any kind of procedure, the medical schools consider that unethical, that you're practicing medicine without a license, and they're not going to let you in. It's going to hurt your application instead of helping it. You know, so watch that if you do go on one of these medical mission trips. The other important thing is volunteering. Community service volunteering is expected. It must be on your applications. They want it there on your applications. If you don't have it, you're not going to get in. But you need to start volunteering now. Doesn't matter what level you're at. Go do some kind of community service activities. Do some volunteer work. The idea is that if you want to be a doctor or any of these other medical professions, you want to help people. They want to see that you really want to go out and help people, so you're going to go do these community service things, not because they told you to, but because you want to. So find a community service activity, volunteer and do things, and do them over and over again, maybe even with different places throughout the whole time, so you can write a bunch of them on your application that you really want to spend time helping people. Some examples of places you could look at, and these certainly aren't all of them. You can volunteer lots of other places. But the Red Cross, Habitat for Humanity, Salvation Army, animal shelters, food banks, retirement homes, nursing homes, lots of places need people volunteering. You know, so volunteer for some of these places and do this throughout your time getting ready for medical school. Any questions about anything? Next, we have to think about clinical experience. The medical schools do not require you to have any kind of clinical experience to get in, but the PA schools do. So if you're interested in a physician's assistant program, be aware that many of those PA schools, they don't just want you to have patient care experience, they want this to be paid. patient care experience. You have to be hired by somebody to take care of patients. This is hard. It's hard to find a position that you can get into to get this experience. Now, you can be an EMT, a scribe, a nurse's aide, a home health care worker. There's lots of different things you can do, but many of them are going to require you to go somewhere and get some training and some certification and licensing to do them. So if you're interested in PA school, find out where you can get licensed, how you can get certified. Take the time to go do it. Like the EMT training course is not terribly long. You can do it over one summer, but then you can get hired and work as an EMT. Same thing regard to nurses' aides. It's not a long training, but you do need to get trained and tested and certified to do that work. So do these things if you're interested in PA school, because they are going to expect these kind of clinical experiences. Any questions so far? The other thing you should think about, of course, is being involved in things here at the school. Participate in pre-med club, join Tri Beta. Tri Beta is a biology honor society. Join chemistry club, work as a lab assistant, work for the department. Do anything to keep involved with university activities. These are all going to look good on your applications when you start applying, that you've been involved in all these kind of things. Now, the thing that surprises a lot of people is the application process starts very early. You don't wait until your senior year when you're getting ready to graduate to apply to medical school. Your application process actually starts in May of your junior year. So at the very end of your junior year, you need to start applying to your medical schools or any of these other professional schools. If you wait, you're going to be too late. They all use an application service. ACOMAS is the service for the DO schools. AMCAS is the service for the MD schools. CASPA is for physician's assistants. PharmCAS is for pharmacy schools. OptomCAS for optometry schools. VMCAS for veterinary medicine. ASAS for the dental schools. But these are all application services. So you go to the application website. They will open their site in May. Register with the application service in May when it first opened and start typing in all your information. Start filling out your application in May of your junior year. Middle of the summer, about June 1st, they're going to open up the site where you can hit the submit button. And when you do that, all your information gets sent off to the medical schools that you're applying to. So you're essentially going to send them everything right then in the middle of the summer. And you would like to have your MCAT scores on there when you send it. That's why you want to take your MCAT end of your junior year, so you can get it onto this application in that summer when you're sending it in. Once the schools get your applications from the application service, they'll read through them, they'll think about things, they'll evaluate things, and they might mail you a secondary application. Different schools have different rules for how they send out secondary applications. Some schools send a secondary application to everybody who applies. OU sends a secondary to everyone from Ohio that applies. Some schools look through your application and decide whether they're interested in you and decide whether or not to send a secondary. But if they send you a secondary application, you need to fill it out and get it sent back by September. If you're later than that, you're going to be too late, and you're not going to be able to get in. Get your secondary applications in. During your senior year, they'll call you at different times throughout the year to have an interview. And you go do your interview and get accepted, or put on a wait list, or rejected, from the schools. But, certainly interviews could go on all year. Most of them start interviewing the 1st of October, and they don't finish until mid-April. So there will be interviews anytime throughout the year. Do not wait on the deadline. If you look at the medical school's website, they're going to say our deadline to apply is December 15th. Guess what? If they get your application December 15th, you're not getting in. All of these schools use rolling admission. That means the first application they receive on June 1st, that one's going to get looked at first. And they're going to start interviewing people. When they interview people, they're going to let some people in. Eventually, they're going to fill up their class and have everybody in. And so people who are after that, you're not getting in, even if you were applied before their deadline, because they've already interviewed a bunch of people and let them in and filled the class. So that's why I want everything done by September, so that you're in that first group of people they're looking at before they filled up the class with lots of other people. Any questions so far? Some things to think about. Some schools will make you take another exam called the Casper exam. Casper stands for Computerized Assessment Sampling of Personal Characteristics. It could also be called a situational judgment test. The idea is that they give you a passage to read about some kind of situation you might be in. Like you're a medical student and you notice one of your colleagues cheating on an exam. What are you going to do? And so they ask you these kind of questions, and you write out answers to these on the computer for this Casper test. They are, of course, graded and judged and sent to the medical schools. So some schools are going to require you to take the Casper test. Right now, it's not very many schools requiring it. I know West Virginia Medical School does, but there aren't a lot of others around here who are requiring it. But that's going to be changing. AAMC, that's the company that runs the MCAT. They created their own situational judgment test to use instead of Casper. If AAMC develops a test, you know that every medical school is going to use it. So expect this to happen in the future. This year they're running it as a trial in 2 schools, but after their trial is over, I wouldn't be surprised if every school says we're using this. Because just like the MCAT, those AAMC tests are developed for the entire association, for the whole country. So expect that you may have to do some kind of test like this with situational judgment. Any questions? Many medical schools have the normal traditional interviews where you're in a room talking to somebody and they ask you questions. But there are some schools that have changed to MMI for their interview process. MMI stands for multiple mini interviews. So instead of doing a regular interview, they put you in stations. They'll have several rooms set up and you're out in the hallway. Outside the door to each room, you read a question. You have 2 minutes to think about your answer to that question. Then you go in the room, you're sitting there with an interview, and you talk about the answer to that question for 6 to 8 minutes. The interview doesn't ask you questions, they don't carry on the conversation, they don't do anything but sit there and listen. You're just there talking for 6 to 8 minutes about whatever your answer was to the question. Once the time's up, you go to the next room and do the same thing. And you go through about 10 different rooms doing this, answering all of these different questions. The questions are based on scenarios, they're tasks, they're not traditional interview questions. You kind of expect questions like, why do you want to be a doctor? That's not what you get in MMI. You get things like, you have a patient who has some kind of incurable cancer, but they're very young. What are you going to do? How are you going to address the issue? Who are you going to talk to? What are you going to tell their parents? What are you going to tell the patient? All kinds of situational things where they're talking about what would you do in various situations. And so you want to read through the question, come up with the answers. These are hard to prepare for. They're very different than a regular interview, and of course you don't know what they're going to ask. But one thing you certainly can do as you're preparing for an MMI is you can think about how much do you have to say to fill up 6 to 8 minutes? You don't want to go in there, answer the question in 1 minute, and then be sitting there staring at this interviewer for the next 7 minutes because you have nothing else to say. That will not get you a good score on your interview. You want to use the whole time they give you. And it takes a lot to fill up 8 minutes of talking. You know, you should try it, and certainly before you get to one of these interviews, and know how much you're going to have to say to fill up all of your time. Be prepared for that if you're at a school that does MMI. There are lots of schools doing this, and the number is growing. More and more schools are starting to do it. Here's some of the nearby schools that are doing it. So Cincinnati's medical school and pharmacy school, Kentucky's pharmacy school, Ohio State, Wayne State, Western Medical, lots of different places that are using MMIs now because it's becoming very popular. So be prepared that you might have to do that. Any questions about anything? And the last thing I want to talk about today is that you are charged a pre-med program fee. It's part of your fees for Shawnee State, and you'll be charged every semester for your pre-med program fee. I think it's important that you know what we're using that for when you get charged that program fee. We use it to support student travel, like going to OMAD, going to the Tri-Beta Convention, any trips that we have to visit the various medical schools, and I know this year we won't be able to do most of those things because of the COVID-19 pandemic, but normally that kind of travel would be supported by your program fee. Club activities such as the banquet, the pre-med day when we invite in high school students, the speakers we bring into meetings, we cover a lot of that for the program fees. We use program fees to support student research so you can get involved in doing research. And we also use program fees to run the Biomedical Sciences Assistantship Program. This is an important program that could benefit all of you. Every spring, usually about February, the applications will be available to apply for the assistantship program. So look for them this February to apply. But what we'll do with this program is if you have taken the MCAT or some other admissions test, you had to pay to register to take that test. I think it's about $300 you pay to take the MCAT. We will reimburse you up to $100 of that fee for taking the test if you fill out the forms and ask to be reimbursed. If you go take an MCAT prep course or a GRE prep course or whatever it might be, we will reimburse you up to $500 for taking that course. That could help a lot with the cost of these prep courses. If you buy books to help you study for the MCAT, or you buy sample exams or online software to help you study with the MCAT, we'll reimburse you up to $200 when you actually send in your applications to the medical schools. That's very expensive as well. You pay application fees, you pay secondary application fees. There's lots of fees you pay. I know people have told me that it can cost them, up to $1,500 just in application fees to various schools to apply to places. This is an expensive process. We will reimburse you up to $200 of your application fees when you apply to the various medical schools. So every year in about February when these applications come out, fill them out and get reimbursed for any of these things you've done. The department will pay you for some of that and help you with these expenses. Any questions about anything? Okay, so I hope this has been helpful and that you'll be, better prepared for what you need to do to get ready for medical school. Okay?
Well, thank you all very much for coming. If you've got any additional questions outside of this lecture, you can come up and talk to us, or you can reach out to Burns, right?
E. Burns.
E. Burns.
Faculty's backwards from students.
I see. My mail?
No.
No?
Faculty's just Shawnee.edu. Only students get my mail.
2 strikes. Or you can reach me or any of the other officers that's it. Thank you all very much for coming.